A warm good morning from Chiromo Hospital Group. My name is Pendo Ochola. I am a hospital psychologist and digital strategist at Chiromo Hospital Group, and I'm very honored to be here this morning to gratefully moderate a session on sober truths. For those who don't know, we happen to be in a month where we are commemorating and working towards creating awareness on alcohol use and abuse. And I'm very honored to be hosting a great panel of individuals with special skill sets, contributions to this conversation today. And I cannot wait to introduce them and have them add on to this conversation. So without further ado, allow me to start from the ladies and then I will go all the way to the gents. I'd like to start with Joy Maele. I'd like to introduce Joy, who is a clinical psychologist working with the Retreat Rehab Center. Joy, please say hi to our audience and introduce yourself. Over to you.
Hi, how are you, Pendo? You can hear me? Hello? Are you able to hear me, Pendo? Okay. My name is Joy Maele. I work at the Retreat Rehabilitation Center. I'm a counseling psychologist. At the Retreat, we deal with not just substance use disorders, but also mental disorders, because there's an interplay between substance use and mental disorders. And apart from chemical substances, that is alcohol, cannabis, marijuana, cannabis, bira, and the likes, we also are looking at gambling, eating disorders, because those are other behavioral addictions that are coming up so strongly, even technology addiction that is also being catered for while at the retreat. So thank you so much for this, Pendo. Thank you.
Sorry for that. I was still muted. So thank you so much, Joy, for that introduction. There's a question I'd like to ask you in relation to the introduction you just made, but I'll put a pin on it and circle back to you after we've introduced the rest of the panelists. Allow me to go to the next lady on the panel. With us today is Maureen Wanjiko, who is also a hospital psychologist with Chiromo Hospital. Maureen, please say hi to our audience and tell us a bit about yourself. Over to you, Maureen. Maureen, you can hear me? Okay, I'll give Maureen some time. Allow me to now go over to the gents. In this panel today, first off, I would like to start with Olela Kamuru, who is a hospital psychologist with us at Chiromo Hospital Group. Over to you, Olela. Please say hi to our audience and tell us a bit about yourself.
Hello, good morning. Thank you all for joining me. As Pedro stated, my name is Olela Kamuru. I'm a hospital psychologist based at the Chiromo Hospital Group, and it's a pleasure to be here with you today. As part of my work as a psychologist, I also engage in the treatment and management of addiction and problematic behavior. So we look at all chemical addiction, and also importantly, we also try to address any behavioral addiction that someone might be experiencing. So we try this to ensure that we are very inclusive and we cap and all sorts and all angles that someone might be affected with. So it's a pleasure to be here today and have this conversation. I'm looking forward to it. Thank you so much, Pendo.
Thank you, Lela. We're glad to have you on board. Finally, we have the other gent in this conversation, and I'm very honored to have him in this session today because he brings a very impactful take to this conversation today. With us is Stephen Olwoch. Stephen, please say hi to the audience and tell us a bit about yourself. Over to you, Stephen.
Thank you, Pendo, and good morning. It is a beautiful morning today. My name is Stephen Olwoch. Lived or living experience, and it is an everyday, ongoing journey. Everyday, ongoing journey, and I'm really glad to be here to be able to have this conversation, join in this conversation with all of you. Thank you very much.
Thank you, Stephen, for joining us today, and we look forward to your insights as we carry on. Allow me to go back to Maureen. Maureen, are you here with us? Okay, we'll make sure to have Maureen on board as we carry on, but allow me to dive. All right.
Hi, Pendo.
Hi, Maureen.
Hi, everyone. My name is Maureen Wanjiko, also a hospital psychologist at Chiromo Hospital Group. So I'm basically located at the Upper Hill branch, which mainly deals with corporate training, corporate awareness. And I'm glad that we're having this topic of discussion today. It's something that we don't talk about much, but it's a good opportunity to be here. Thank you.
Thank you so much, Maureen, and we're glad to have you on board. As I stated when we were starting, this month we get to commemorate and we get to create awareness on alcohol use, alcohol abuse. And this is why we have curated this conversation today. We want to understand how alcohol would have an impact on someone's life, but in addition to that, is it possible for us to regain that life? And we have both a hospital psychologist, a psychologist from a rehab center, and also lived experience to add to the insights in this conversation. I want to start with you, Joy. I was interested in the introduction that you gave. Not only do you look into alcohol, but you also look at other substances as well as behavioral addictions. Before we start this conversation, I know it's going to be geared more towards alcohol, but do you feel like the insights that will be shared in this conversation will apply to all of these other instances that you've given? Over to you, Joy.
Thank you so much, Pendo. Yes, like I mentioned at the retreat, we don't just deal with substance use disorders, that is alcohol only. We also deal with other substances, prescription medications, marijuana, we have amphetamines, the Miramo, Goka, we have tobacco, the cigarettes, the Chavis, the Kuber. We're also seeing cocaine, heroin, pethidine, and the like. So for this conversation we are going to have today, in as much as we are going to gear towards alcohol, but part of our discussions is also going to touch on those other substances and how do we go about them, because at the end of the day, addiction as a whole looking at whatever sort of substance that somebody is being affected by, it's the same, because it's the brain disease, it's the brain is affected and how it's supposed to do its functions. So whether it's alcohol or it's tobacco or it's cannabis, addiction is the same. The only difference is now probably when it comes to withdrawal symptoms and how to deal with certain situations, that is going to be a bit different. And if at all we're also looking at a mental disorder in play, it also gets a little bit different or deeper in terms of management.
Thank you for that, Joy. So what I'm getting from that is that as much as you're focusing on alcohol today, a lot of the insights shared will also apply to other forms of addiction. So this is going to be an all-round learning experience. So let me dive straight into the essence of this conversation. And I'd like to engage you, Maureen, for starters. Addiction is a word that is thrown around here and there, and it's used quite often. But a lot of times we realize that people do not really understand what addiction means. From your experience, what is the clinical definition of addiction? And just to add on that, how does alcohol take over someone's life? Over to you, Maureen.
So normally, even while we are talking about addiction as a term, most people tend to think addiction is more of something someone chooses rather than it being an illness or a disease. Whereas addiction clinically is normally a chronic, compulsive, psychological need for a substance or any behavior or activity that one does, neglecting the fact that it may have harmful effects to them, their family, their bodies. But now on to now alcohol addiction itself. Remember, I think Joy mentioned that we can have both substance addictions and even behavior addictions and all that. But now on to alcohol addiction. Clinically, we term it as AUD, that's alcohol use disorder, which is a chronic brain illness or disorder distinguished by that compulsive need to consume alcohol despite knowing the harmful effects it has. Yeah. And normally, even to get to that point of getting addicted to alcohol, it will go through several stages. There'll be that stage where you just start doing it, having fun. It's not that serious. You're a social drinker, or you're even experimenting. Let me see how I'd feel by taking alcohol. And then now it becomes like a regular use kind of thing. It was a once in a month. Now it's every Friday. It becomes a consistent part of your life. And then now it moves to it being risky, or you start using riskily. You know, every time you're having stress or an issue, the first thing you go to is alcohol or your drink of choice. And then now it gets to be dependent. You start being dependent on it. Your tolerance gets higher and higher every single day. And then now it gets to addiction. And now with this cycle of addiction, it normally develops it's very subtle. Yeah. It will often masquerade as just normal behavior. And I think us here now, we have normalized it so much that we don't see how it can also be problematic. These days you'll just see many people drinking, and that's just a normal behavior, you know. Yet it is leading to a lot of physical issues, physical health issues, mental health issues. Yeah. So I think that's what I'd say, how it just progresses.
Thank you for that, Maureen. And I like that you said that, sometimes it might seem like normal kawaida behavior. I don't know if anyone who's listening to this conversation, if you're on social media, you know that Kenya is known as one of those countries that tend to be up there when it comes to alcohol use. We're known to have a high tolerance and, linked to that reputation. So I can see how a lot of people would be lost in that umbrella of, we're having fun, there's this name we're trying to keep up, but on the ground, in real sense, what is the impact of this to one's life? I want to introduce Stephen here. Stephen, I'd like to indulge you in terms of this particular question that you're exploring right now. From use of alcohol leisurely or for whatever reasons that someone uses alcohol to the point where you've lost control over your use. How does this progressively come up? And are there signs that you can look out for? Are there things that you can spot as warning signs to tell you that perhaps you're walking towards addiction? Over to you, Stephen.
Thank you, Pendo. That's a full question, full-on question. I think for me, simply because it's a personal living experience. Just to take it from the top, get to a place where I would feel that I'm very uncomfortable. Something is missing. Something is wrong. I'm not settled. I'm not calm until I actually have my my drink or my substance. And then, like Maureen was saying, starts progressively. I'm then using big amounts, consuming more amounts. I'm then experimenting with different kinds of alcoholic beverages. Get to the point where now you're actually mixing what they call mixing drinks, which is always a big risk. And before you know it, you become one of those who just go all out, and next thing, or the end of it is a blackout, or you're crawling on your knees, or you've just caused some serious damage to yourself or even to others, including their properties. So it just goes from almost leisure and casual to full-on destruction and damage, which could also even get you to the point of life-threatening consequences. I know for myself, one of the many incidences that occurred was me coming down Wayaki Way early in the morning from a graduation, my cousin's graduation, by the way. Just graduated from the University of Nairobi. I obviously went to celebrate, because now it has become a problem. There is no control. So you're became one of those, if you're out at the party, then it's going to end in drama. There's definitely gonna be some drama. Anyway, in this particular instance, speeding down the highway under the influences, and went right into one of these trees on the side of the highway. I think it was just after or just before Nairobi School, if you know where Nairobi School is. And the vehicle was a write-off. I had my younger cousin, in the vehicle, and I had my peddler in the vehicle as well, because we went and had a drink. And then after using the alcohol, then you start to want to use some of these other substances. Okay, you're talking about more than just the alcohol. Anyway, the vehicle was a write-off, and I feel guilty about it until today. I wrote my uncle's vehicle off, almost killed my cousin and my friend. My tongue was cut in half. I don't want to be too graphic. Managed to walk all the way to my home. My brother got me to the hospital. I had stitches in my tongue, and yeah, the rest, as they say, is history.
Wow.
Thank you.
Thank you so much.
I don't know if that makes any sense.
Yes. Thank you so much, Stephen, for even sharing your story with us. I know this is not as easy to you, but thank you for sharing this story to us. And this is also contextualizing this conversation to anyone who's listening to you today. We're looking at, and from what I'm getting from you, is the extent to which this can get. I want to take a moment and go all the way to the start. What really is behind these cravings? What is really behind this urge? And I want to indulge you, Olela Kamuru, in this. Based off your experience and your knowledge, what really is behind the urge to keep drinking? How do you progress to that point? And what really triggers this constant use? Over to you, Olela.
Thank you for the question, Pendo, and a big thank you to Stephen for also sharing. And such conversations become more meaningful and even more productive when we have brave people like Stephen who can be able now to also share their lived experience so that we can see practically how things happen. Now on to your question, how does this happen, right? Most of the times when we look at substances, when you look at addictive behaviors and even things like that, of course, everyone knows the negative effects, right? Especially in our context here in the country, these are things that we are taught from day one, right? Even a child will be able to sing the negative effects of drugs, all those things every day. But if you are to really understand substances and be able to empathize and offer support, we can't just look at one side, right? Most of substances offer something, right? And as the Swahili said, kono tupo ulambwe, right? So this is just to say that in as much as we know all the negative effects and all the reasons why substances are frowned upon, most of the time when we engage in activities, because it's offering us something, right? There is definitely something that every substance is offering us. And if you are to start off on the process of understanding ourselves and even starting on the journey of recovery, you need to be, as an individual, find out what is this substance offering me, right? And because that, then now you'll be able to notice the gap. I depend on this substance to be social. This substance offers me a relief from boredom. These substances, I have paired a lot of things that I do every day with this kind of substance. So when you're able to be very honest within yourself and assess and find out what a substance is offering you, then yes, that's one step towards the recovery journey. Remember, in the process of addiction, we have psychological addiction, right? This substances is offering a lot of things, and now we start getting to a place where we're embracing it and we are protecting it from other people's opinions. So with that in mind, once you are able to find out what a substance is offering you, then now you can bridge the gap. Over the test of time, maybe I have used for 10 years, but then over the last 3 years, my usage has become problematic. So were we able to notice when my use changed from recreational to coping? Because now that is when now things start becoming very serious and very bad. When we pair our substances with everyday activity, right? Then now we can get enjoyment from any sort of activity. We have to be able now to come with a substance to get the same feeling from everyday things, right? So those are some of the things that bring about, and before you know it, now we are deep in, right? And one of the biggest triggers, because before it even becomes a trigger, it's because that is what it was offering us. There's a lot of stressors in the world, right? And over time, because we don't have a lot of coping skills, we depend on substance as a way of coping. It might not be healthy, might not be sustainable, but we have to be honest that it works, right? I will be able to fall asleep, even if I wake up in the morning with the same problems, but I have what, 2-3 hours of relief. And we have to be able to consider that, because that's why some people use. Because if you can see the gap, then now we can be able now to bridge it. This is the role that these substances are playing in my life. So is it possible for me to get the same things done minus the substance? If I'm depending on it for my social life, am I able to develop social skills? Because if we just drop the substances, right, minus these things, then relapse is very easy. I turn to use is very, very easy. Imagine you have one way of tackling stress. You only have one tool, and it's a substance, right? Then most of the chances are, whenever a stressor comes up, you will be still go to your go-to way of coping until you find other means, right? And that's the thing, especially with addictions and substances, they limit our creativity, right? They limit us from thinking beyond the substance, because if alcohol seems to be solving everything or numbing all the difficult emotions, then I won't be creative enough to think about, okay, what are the alternatives, right? When I'm even using alcohol or a substance when it's cold, right? When it's not available, it's when I think, okay, I can drink a cup of coffee, I can put on a jacket or things like that. So in this process, even as we identify triggers and the rest, it's important to find out what purpose is this substance is offering us. It's different for everyone, some cut across, but when you're able to pick your own personal ones, then it's a bit easier for you now to be able to see, so this is the gap. These are the things that I have to make up for me to prevent a return to use. Yeah, thank you.
Thank you so much for that, Olela. And I'm still going to indulge you a bit more on the same topic. I like what you've said, and someone once said this, I don't know if you agree with this, that no one starts using a substance with the goal of getting addicted. But one way or another, you find yourself in that loop. You're trying to quit and things still, keep getting you back to it. You're trying to quit and you still find yourself going back to it. How can we stop this cycle? What are some of the strategies that you can use to manage some of these triggers that you encounter on a day-to-day?
Yes, that's a true statement, right? People rarely chase after addiction. This is something that we meet along the way, right? So in our everyday activities of indulging and enjoying substances, right? And remember, of that substances serving a purpose in our life. So we constantly use it for a long time. And remember, one of the definitions of addiction is continued use despite clear negative consequences. So I have seen my health, my relationships, my work, my finances, all these things. And the thing is, most of the time we hope that when these negative effects come, there will be an eye-opener. But sometimes these consequences are what makes us fall deep, because why should I recover when I've lost my job, my family, my health, right? Everything is now in chaos. If in fact, that's more of a stressor. So is the reason that you think it will make me go up is now the reason why I'm even going seeking lower, because all the support system, everyone has now either abandoned, or because of my problematic behavior, the relationship is now irreparable. So we sink deeper and deeper. But then now, how can we now manage some of the stress? Everything most of the time starts with self-awareness. Find out, what are these things? If I was to cut off drinking, what are some of the things that I would find very difficult to handle or manage? Then now those are the things that we now have to find out. I have paired my use with sleep. So we know it will be just a chain of tossing and turning for days without sleep. I have paired this with my work. I have paired it with something else. So if I was to drop it, this is the part of my life that will be affected. So once we have that, now we have a clear picture of now what we need to do next is to bridge this gap and bring something on board. So what happens from there on now the triggers will now just coming up. Or like Mr. Stephen mentioned, right? Some of the triggers could be especially emotional, right? Emotional triggers sometimes are not very easy for people to pinpoint. There's a certain kind of emotion that most of the time drives me to a habit. And it's not just negative, like maybe stressors or sadness or anxiety. Some of us don't know what to do when we receive good news, right? I only celebrate in one way. So when there's a graduation, what else am I supposed to do? When I get a promotion, when a good deal goes through, right? So some of us only know how to celebrate in one way. So I can maintain days of sobriety, then good news happens, and then, right? So even when you're looking at triggers, not only the negative parts, right? So even some of the things that we chase after, like success, can be a trigger, right? On top of other everyday activities, social gathering, loneliness, right? You know, loneliness is a modern problem, right? A lot of people suffer with loneliness, and you're alone, you only want one perspective. Then substances can be a good partner. And like I said, we have to look at some of the, let me say, good things that these substances are offering us, because if we constantly label them as bad, then we will struggle to understand, why is this person still drinking after all these things have happened to them? So self-awareness, identifying the role of the substances in your life, then the triggers will now come up. When the triggers come up, now it's not a matter of replacing them, right? Sometimes as an individual, it's not easy. That's why we have support system, family, and even professionals. Yes.
Thank you for that. Self-awareness, understanding what role this substance serves in your life, and then from there, it becomes clearer to you what the triggers are, and it's okay to seek help. At this point, I'd like to bring in Joy Maile. Joy, allow me to throw you under the bus just a little bit, and this is because there's a lot of stigma where the word rehab is concerned. Every time someone hears that someone went to rehab or someone's supposed to go to rehab, there's a lot of stigma that comes along with that word. I'd like to prompt you to give us just a brief description of what someone would expect when they are in a rehab program or when they come to a rehab facility. What should someone expect? What are the benefits of such a program? Over to you, Joy, just briefly.
Okay. I can't find it with you, but anyway, at the rehab, I know whatever you're saying, Pendo, is something that we've experienced a lot of times, especially when we get clients who are involuntary. Most of the time, they come in with a mindset that they've picked from the layman's perspective that rehab is not really a good place. So when you're coming in at first, you're very scared. I'm going to be locked up. It's more like a prison. But then again, when you come to the retreat, for instance, we have programs. We do a minimum stay of 90 days. That's equivalent to 3 months. And in these 3 months, we have a program that runs through. So you come in, the first month is about understanding your problem and understanding what addiction really is, because again, outside there, most people don't even understand addiction. They think addiction is when I'm being picked from a ditch. It's when I was not able to go back home. And there are those people who actually get to go back home, but work is a mess, family is a mess, and you still see that is part of addiction. So month 1 is all about understanding, what is this addiction? Why am I here? What do I want to do? Because the aim of a rehabilitation center is to transform your life back to the person you were before this substance took away that bit. Then second month is all about life skill, because like Olela is saying, most of the time, it starts off as fun. Even Maureen has mentioned, it starts off as fun. It was once a month, then eventually it's every other Friday, eventually it's every other day, and it stops being fun and it's used for, I'm abusing it. I want to go to sleep. I want to eat. I'm going through a stressor. And you see now for us, month 2 looks at those skills enhancement, because now can we rebuild on your stress management skills? Can we look at financial management? Can we look at anger management, emotional regulation, and so on? Because those are some of the things that are underlying that can push somebody back into addiction. Then our last month, most of the time, we look at relapse prevention and management, exit planning, life after rehab, because it's like you took a pause to understand and reflect on your life and regain back control. So now you're going to go back to the same world that you came from. So how are you going to transition from now the rehab with everything that you've gained back out there? So rehab is not just a place where people are locked up and no. We have a program that runs. And apart from all that I've mentioned, we also have sports, we have occupational therapy. You engage in other things just to help you realize, what else can I do with my life? I hope that answers, Pendo.
Yes, thank you so much for that. A lot of times stigma comes from a point of not knowing, and thank you for highlighting all of that to us. Olela briefly talked about triggers, and what triggers lead to is cravings. A lot of people who find themselves in that loop really struggle with managing cravings, and there are certain techniques that help us to manage that. I'd like to indulge you a bit still, Joy, from your experience working with the retreat, typically dealing with cravings. What are some of the strategies that really help for someone to deal with those, to prevent a relapse?
Okay, thank you so much for the question. First, it's important to understand what are cravings, Cravings are these intense desire or urges to either use a substance like alcohol or engage in a certain behavior like gambling or even technology addiction, So the cravings are psychological, and at the same time, it's a physical response that occurs in the brain, and it is associated with a certain behavior. So these cravings can arise from triggers. I have gone to a place, it could be a club, it could be a restaurant, but it's also a bar in itself. So that could trigger a craving in somebody. People, there are those friends you used to go out with. So when you see their phone call or when you see their text, it just, somehow it makes you feel excited, some butterflies in the stomach and whatnot. Also emotions, how maybe you used to go drinking to feel excitement. It's a birthday, it's a wedding. So whenever you're excited, alcohol has to be in play. Or whenever you're going through like a sad moment or angry moment, then you'd like to engage here. And then habits. You are used to every day after work, we go drinking. So you'd realize that when it gets to around 4 p.m. or 5 p.m. thereabout, you're already having this intense desire or urge to actually engage in a particular habit or substance. Then, of course, sometimes even the withdrawal symptoms where you either having a headache, you're having tremors, those are some of the things that could actually get you back. So some of strategies that we use, there's something called urge surfing. When we talk about urge surfing, it's a mindfulness-based technique that it is used to help people cope with cravings. The idea is to observe the urge without giving into it, So for instance, you notice the urge that I'm actually having that craving, then you observe it mindfully. What that means is focus on where are you feeling. There are people who will feel some tension in the chest, like I've mentioned, others would feel butterflies in the stomach. So observe it mindfully. What are you feeling? Then try and breathe through it, take slow, deep breaths, watch the sensation rise. This is just to make you become aware that this is what is happening. And then we keep saying, cravings are not things to be ashamed of. So don't fight it, don't avoid it, don't judge it, acknowledge it. Don't try to push it away, because it's like putting dirt under the rug. you'll keep putting it there until the house becomes stuffy. So don't judge it, don't push it, acknowledge it. Then remind yourself that this is just temporary and it's going to pass. So that is one way of actually dealing with cravings, where we use the ad surfing as a way of just practicing mindfulness and seeing how best somebody can deal with a craving. Back to you, Penda.
Thank you so much for that, Joy. On the same bit, there are people who might have tried the same concept, but it seems to not be working the way they would like it to. Are there any limitations to ad surfing? What things that would limit its success, chances of success, if someone was to try and implement ad surfing?
Yes, thank you, Pendo. One thing I would like also to mention is that when it comes to addiction of any kind, what may work for me might not work for somebody else. And everything has its advantage and disadvantage at the same time. So when you talk about limitations, especially when it comes to ad surfing, it takes practice. I think most people, when they're looking at alcohol addiction recovery or substance addiction recovery, they're looking for shortcuts. What can I do? Is there something that I can take? Is there something that I can do? And this goes away. So everything, when it comes to recovery, it's a process. So it takes practice. So at first, and we say when you look at statistics, most people relapse in their first year of recovery simply because it's something new. You're trying it out with an expectation of it's going to work tomorrow or it's going to work today. And then it does not work as you had expected. So you slowly start giving up. So it needs a lot of practice for you to be able to strengthen your emotional resilience when it comes to dealing with cravings. Number two, when it comes to limitations, it's also, like I'm just saying, it's not a quick fix. So it works best when you keep doing it. And that is how therapy comes in, because there's the aspect of CBT. Can we look at your thought patterns? So how does your thought patterns affect your feelings or emotions? And then in turn, it looks at your behavior. We need to look at all that. So it's not a quick fix that we'll do it today and it's done. So the other thing is that it could also be challenging for people who have severe trauma or have an emotional dysregulation, which without the support system. So it becomes a challenge or a limitation, because if you're going through something and you don't have the right support system, there's a highly likelihood of this person just going back or, falling back or accepting or, going back to the cravings, or acknowledging that the cravings are here, there's nothing I can do about it, and just conform to them. So support system is also important. And sometimes people don't really get the right support, because even the people who are giving support do not understand what kind of support am I supposed to give this person. Or even that person who's going through the recovery is not so sure what kind of support do I really need at the moment. So such things can actually be a limitation, but the biggest thing is that this is not a quick fix. Recovery is a process, and you keep working on it every day at a time, a day at a time.
Thank you so much for that. Recovery is a journey, it's a process. You keep working on it a day at a time. I'd like to come to you, Maureen. One of the common experiences we see is when someone has left rehab and there seems to be, there's this confidence that I'm back to the world and I can tackle whatever comes my way. And as Joy said, that during that first year after rehab, a lot of times people people find themselves relapsing. And the question is, what really is the missing link there? And a lot of times you find that therapy, as Joy has said, happens to miss in the picture. We feel like, going back to the world, I have everything that I need, and we forget that there's some other forms of support that we need after going through a rehabilitation program and going back to your environment. Maureen, coming to you, how important is it to pick up therapy and carry on, now have it part of your journey after going through this program? And in addition to that, are there any other strategies that we can work with, that we can implement to complement urge surfing to help in managing cravings? Over to you, Maureen.
Hi, Pendo. I like what Joy has said, that going through this process of recovery and just dealing with this addiction, it's not a one-day thing. It's a process. It will take time, and normally they will have relapses in there. And I think it's high time we actually, redefine what relapse is. When we think about relapse, we just think my recovery has come to an end. I have failed, I have done this, but it's actually part of that process of recovery. And in urge surfing, again, it needs practice. You need to do it over and over again. There are some days where it might not work, the urges are too strong, and that's where therapy comes in. You need that extra support. Addiction is not something that you can go through by yourself. You need to talk about the emotions you're feeling during that time, the triggers that came about, and actually learn from that experience, learn from that relapse if it did happen, and move on. So you can't do it by yourself. We need therapy along the way. It's very important. You need someone to walk with you, encourage you, and just support you through this journey. And other techniques that can, play hand in hand with urge surfing is the breathing technique. As much as we downplay it so much, it has such a huge impact. You just think about breathing in and out, and I remember when we used to be in school, we used to not know how powerful that technique is. When your teacher will tell you, just breathe in and out, even during exams, and you just ignore, you don't understand what I'm feeling, but it really has a powerful impact. Just knowing how that technique really works. Breathing in for like 5-6 seconds, holding and breathing out, it really comes hand in hand with urge surfing, because even as Joy has said, think of urge surfing as like the waves in the ocean. It will come to a point where they will rise, they will be at its highest point, and eventually they will end up passing. So urges are not permanent, they are actually very temporary, you know. And I like what you said, you first have to acknowledge that I am having this urge, and choose not to act on it, and just treat it as a wave. It will come, it will pass. You don't have to give in to that urge. And start
Thank
small. Yeah, start small and grow in that technique.
Thank you for that, Maureen. So start small and grow. Understand that this is temporary, to come to pass. Acknowledge that you're experiencing that urge. Thank you so much for that. And you brought in a very also common experience, and that is relapse. And I like that you've taken us to understand exactly what a relapse is. Stephen, I'd like to engage you at this point, based off not just your experience, but also what you have learned through this experience. Relapse. What are some of the signs that you can look out for? How could we tell that, there's a relapse that could be impending? What are the early signs that you can look out for? Actually, even before you respond to that, is it possible to tell that you're on track to a relapse? Is it possible to tell that you're not on a good path?
Thank you, Pendo. Yes, I think it is possible for me to see that I'm going off track or realize it if I'm aware and honest with myself. One of the common ones is when you start to skip meetings, support groups, or even therapy sessions. If you're on a medication, you've stopped using your meds, or you're using them even more, because sometimes what also happens is when you're on treatment, psychiatrist puts you on meds, and then you begin to get a good feeling out of it, and you start to use it a bit more, or you have relapsed already, and I'm back in the bottle, but I'm also trying to use my medication at the same time. When things like that happen, how am I going to respond? Am I going to speak to somebody? Am I going to come to therapy? Am I going to come to the doctor and say, hey, you know what? I just slipped up last night, or I'm having these obsessive thoughts through my mind, or I'm going back to my old environment, which for me I'm getting over it as I grow. The old environment, part of my journey had me moving geographically, so physically moving from an old environment to a different one. And so when I stop doing the things that I know I should do, for whatever reason, then I'm asking, so why am I not doing it? Then if I'm honest with myself, if I'm switched on, sometimes we're not, I can begin to tell that, you know what, this train is just about to derail and crash. It's really an awareness. I would like to also say it is very important to have somebody you can speak to, or at least somebody you can share what's going on, preferably someone who might have an understanding, or just even somebody who would be able to hear you out. So I can be accountable quickly and not wait too long. And so if, for example, Brian is my good friend and he's not hearing from me in a week or 2 weeks, then even you, who knows me and who is aware of the kind of journey I'm on, would be able to maybe even just pick up a call. By the way, Brian himself has done that and does that for me. Sometimes he just picks up the phone and I'm like, yes, what is it? And he's like, no, I'm just checking in. Yeah, so when I begin to isolate, begin to act a little bit different than I have been on my progressive trajectory, then those are signs that something is happening. What is happening, I might not always know. That is when I need to speak to somebody like yourself or any of you on the panel. Help me unpack what is really going on. A lot of times we actually don't know what's going on until it happens. Thank you.
Thank you for that, Stephen. And there's something I'd like to piggyback on. I've heard you say twice, when I'm very honest with myself. In your experience, how important is it to be honest to yourself through the journey of sobriety?
I think that's where it actually begins, is me being honest, getting over that denial, and then getting to the place where I'm doing it for myself and not for others. Because in my journey, through multiple rehabilitation centers, by the way, including Chiromo Lane, for the record, it was not about me. Okay, first there was denial. Then I realized, okay, this is affecting so many people around me. It is affecting even sources of provision. So, or even sometimes, depending on what your offense is, you could even be arraigned in court, and part of your sentence, or how can I say, judge or magistrate decides that, okay, you need to go to rehab or you need to get into a program. So it becomes an escape from more severe consequences. And so until it is genuinely something I want to do, and I think that is really the turning point, or that's where it begins. I have to be true and realize and accept that, you know what, this is not working for me, and I really need to and want to get myself back on track. That's where it begins, being honest at all times, being vulnerable, I guess, with yourself and also with others. It cannot work without honesty. That's how I see it.
Thank you so much for that, Stephen. And I want to also throw the same question to Olela. In your experience and interacting with clients who are going through, they're struggling with recovering, how important is it for them to be honest with themselves where the indulgence is concerned.
Okay. Thank you for the question, Pendo. Honesty within self is actually the biggest part of everything, right? Even as they say, like a path opens to those who are honest, right? And of course, most importantly, honesty saves time. You see, now when you're very practical to what you want to meet, especially even if you meet a client or a patient coming in, sometimes you ask them, what is your goal in terms of the substance you're using? Some want to quit entirely, some maybe just to manage their use, some want to use without less consequence. So you have to be able to find out where they are and what they're hoping to achieve before now we start flooding them with what actually should be able to happen, right? And remember that honesty is not very easy to get into, right? Because in the path of the process of addiction, right, we come up with a lot of defenses to protect. Imagine engaging in something that everyone is against, right? A behavior that maybe is frowned upon. Every now and then, everyone has comments about what you should do better. Over time, you build fences and walls to make sure that your opinion is yours alone and doesn't matter. So this process of psychological addiction, these are the ones that sometimes prevent people from getting to accept and getting to be very honest with themselves. But this sometimes can be initiated, especially from professionals. We have tools where we can just choose to show someone that, okay, this is what you want, this is what you're doing, what would you like to achieve? And say when those gaps are highlighted, someone is now able to notice, okay, there's something I need to do. Then others actually, they understand they have a problem, right? They understand that I need to change. But again, we're talking about relapse, right? It gets to a place where some of us, sometimes you're scared of failing, right? Especially when you've had multiple attempts at sobriety. Or last time I went 6 months, I failed. So what's to say that this is gonna be different, right? So we feel defeated. We almost feel like we know what the next outcome is going to be and it's going to look like. So with that in mind, especially when you interact with professionals, just to highlight to you that, remember, this is different. Recovery is part of the process. And especially with relapse, right? Sometimes one thing that a relapse does, and I'm glad that Steve has brought it up, that we went back to his support system, went back to therapy, is that picture this as for the practitioners who are joining me. You have worked with a client or a patient, right? They've been 6 months sober, and you know how that feels like. Even in a treatment room, they're always walking in because they're told you need to acknowledge the successes and every win along, either whether small or big, right? So it's been 1 week, it's been 3 weeks, it's been 1 month. So they're sharing all these things, then a relapse happens, right? Oh, so what am I going to tell my psychologist, Pendo? She's really tried to work with me, telling me how to manage this, especially this exact relapse that maybe I succumbed to. She took time. So there's guilt, there's shame, there's embarrassment. And that's why sometimes relapse hits very hard, because one thing it will do, it will alienate you from the support system, right? All those accountability partners, you're not picking their phone calls because there's so much shame. You feel like you've let people down. So what happens is, even now, to avoid even more shame and embarrassment, now you change your entire group, right? So you find yourself now predominantly engaging with people who are deeper into use, because remember, there is no judgment in a place of use, right? In fact, the more you bring, the more we celebrate you. So making very sure that even us as practitioners, we remind the clients that we are meeting that, you know what, relapse can happen. And when it does, remember, it is this in this very room that we address those relapses. So when you experience a relapse, don't feel like, you've let me down, you've let yourself down. Of course, those feelings could be there, but don't let relapse take you away from treatment. Remember, those periods of sobriety that you had, be it a week, a month or so, it was possible because of the support system, the routine you put up, the professionals you're interacting with. So when you drop all these things, chances of you getting back on the path is even less. So bring those relapses to the treatment room. Bring those relapses to your support system. Bring the relapses to your accountability partners, right? Tell them so that we can iron it out. Don't let the shame, guilt, and embarrassment that comes with relapse completely take you away from treatment. So we have to remind them that relapse is possible and what to do about them. And then as an individual, when it happens, despite feeling like you let yourself down, you need to show yourself some self-compassion. Right, yes, because when you love something, you go out of your way to make it work. But when you don't love it anymore, you can just watch as it crashes and burns. So I think those reminders might be important to us as practitioners and even to the clients that we serve in regards to relapse. Thank you, Ben.
Wow, Thank you so much for that, Olela, and breaking it down really well. I'm seeing that you have questions that are coming in from our audience. Please feel free to type in your questions in the Q&A section if you have any. And after this session, we will have the panelists to respond to your questions. I'd like to come over to you, Joy, based on your experience working in a rehab facility. And this conversation is geared towards driving anyone who is struggling with substance use, alcohol, and the rest towards a journey of sobriety. As you're working towards that, what are some of the strategies that can help someone to maintain sobriety? Say someone is watching this today, they're just from rehab or they're going through therapy and they've gotten to 2 days, 3 days, 4 days sober so far. Their goal is to maintain that for as long as they could. What are some of the strategies that you can use to maintain sobriety? Over to you, Joy.
Thank you so much, Pendo, for that. First of all, I would like to let people who've attended this webinar understand that sobriety is more than just the abstinence of whatever substance of choice they were taking, be it alcohol, cannabis. It's more than just abstaining. Sobriety is about change of belief system, change of attitude, and change of behavior. So if we are looking at strategies of maintaining sobriety or being in recovery, the very first one is to develop a support system. This support system can be sober friends. This support system can be family members. This support system can be AA. I've heard Stephen mention that. It can be AA. It can also be therapy, because that is also part of support system. And here at the retreat, we have what we call the aftercare, that once you're through with the program, we don't just let you go. We have a follow-up session, and we call it the aftercare. The other thing is identify and manage your triggers. Part of our program here helps the client identify what really are your triggers, because you'd be assigned to a primary counselor or therapist who you'll walk through with them, and you'd be able to identify what are my triggers, because people's triggers are different. Now, how do you manage your triggers? Because you are the only person who knows how your life is outside there. So what are the realistic ways of actually managing your triggers? There's something Stephen has mentioned that is very, very important, and most people need to understand when it comes to strategies. It's routine and structure, maintaining a certain routine and structure. There's a program. You have to keep doing it. You have to keep following this routine. You have to keep following that structure, because it is what is making you stay sober. If you don't have a routine, if you don't have a structure, then slowly you find yourself slipping back into your old behaviors. So you really need to have healthy habits and a daily schedule of what is expected of you. There is also the need to set goals and purpose. Part of our program here, we do something on goal exploration and goal exploration and setting. Reason being, when you have a goal, then there's the need to, I want to achieve this goal. So it motivates you. You want to keep doing it. So could it be career? Could it be education? And also rebuilding your relationships and trust. So that goal is what drives you. So anytime you're having a craving or you're almost slipping back and you remember this is against my goals, then you quickly redirect your thoughts and you're like, no, this is not what I want to achieve. That is what I want to achieve. And you go there. Then another strategy that most people, it's underrated, it's also celebrating milestones. You know, we keep saying a day at a time. So if a day has passed and you've been better than you were yesterday, oh my God, celebrate. It's a milestone. Reward progress for yourself with healthy treats or trips and so on and so forth. It's another way of just telling yourself, Joy, keep doing it. You're doing well. Then have a plan and also keep educating yourself. The world is so contemporary and we keep getting new things. I know back in the day when people would talk about addiction, it would only be more like it's the hard drugs. And also I'm not addicted because it's the hard drugs. But today people are embracing that also with alcohol, you can get addicted. With phones, we can get addicted. With gambling, you can get addicted. We are slowly embracing all that. So it's also good to keep, stay educated, stay informed. What is going out there? What is happening? What else can I do? And so on and so forth. So that is just that some of the ways that somebody can actually, those are some of the strategies somebody can actually use when they are in recovery or they're trying to even avoid a relapse. Yes, Penda.
Thank you, Joy, for that. And towards the end, you talked about being aware, being informed about what other forms of addiction someone could succumb to. And I would like to bring another concept. Again, I'm throwing you under the bus a little bit, and this is more on awareness here. I'd like to prompt you to tell us a bit about the concept of cross addiction in efforts to recovery.
Oh, the concept of cross addiction, right?
Yes.
Okay. Cross addiction also happens a lot during the first year of recovery because assuming you've been admitted here because of alcohol use, and once you've been discharged, if this person thought, okay, the problem was just alcohol, but probably didn't work through to understand why did they even look for alcohol in the first place. That urge to be high, that urge to, when it comes to addiction, there's the brain associates certain behaviors with relief, reward, and escape. So if you're still looking to escape, you're still looking for relief, you're still looking for reward, you might find yourself engaging in another behavior, say whether it's gambling or it's the phone, or you decide, fine, because alcohol was the problem, can we do Mira or Muguka? And that's how cross addiction comes in. You're still looking for the same relief, the same reward, looking for an escape route. But now for you, you're telling yourself alcohol was the problem. So let me not use alcohol. Let me use this other thing because now this is different. So that's how cross addiction comes in play.
Wow, thank you so much for that, Joy. And what I'm hearing is it's important for us to be aware that, yes, you could be in for alcohol and you're trying to handle that, but it's very possible for you to develop an addiction for something else, trying to cope with this other addiction. So this is all in awareness. If you're here and this is an experience that is, it's something you're going through, please seek support for it. I'd like to bring Stephen back to this bit of the conversation. And Stephen, this is coming from the point of a lot of times you hear that with an addiction, and this has been very well put across by all the other panelists. There's an element of shame, there's an element of guilt, there's the impact that it has on relationships, your finances, family, work, and all of that. And this happens to be the aftermath of it. You've gone through a program, you've been taken through how to manage these cravings, these triggers, and all that comes with. But now you're back to your world. You're back to the aftermath of all that you had done before. What are the strategies, or rather, how is the experience of picking yourself back up from what was to what you want to be, what you want to achieve moving forward? Stephen, over to you. I hope I was not muted through all of that. And if I was, Stephen, I was directing a question to you. Are you here with us? Okay, allow me to go to Maureen. Maureen, are you here with us? Okay. Olela, can you hear me?
Yes.
Okay. So well, having that, you're the one who's responded. I might need to also throw you under the bus with the next question, yeah? If you allow me. And this is on the recovery bit, rebuilding your life after the aftermath of what one goes through during the journey of addiction. A lot of times you've heard that it affects your work, finances, relationships, your own sense of self and esteem. What are some of the tips? What are some of the things that you can work on when one is rebuilding their life after going through that?
Yeah, so depending on how much was affected during our time in use, that will determine how much work we need to do. And sometimes also sometimes it requires even more work than that, right? Because among the ways, there's time that is wasted, there's a lot of things, there are a lot of relationship that needs to be amended. We need to rethink a lot of things. We need to rethink even our boundaries, a lot, pretty much all things. Because remember, for me to get to addiction, right? It's a process. It takes a while for someone to get into a full-blown addiction. And remember, the longer that process takes, sometimes the more things. And the thing with the addictions are very selfish, right? Because they demand a lot of your time, a lot of your attention, a lot of your resources. And that means that a lot of the things in life will be abandoned, unfortunately. Right. So most of the time, especially as someone who's recovering, you might struggle to know where exactly do I need to come in. But if you have access to professional, then you can work together, right? You tell them some of the things that you feel like you need to make up for, you need to make amends for. Then from there on, now you can more or less explore how do you now prioritize and where do we start off from? Of course, there are those ones that are very important, maybe that can't be given precedence. First of all is our health. Right. Remember, for you to engage in this process of recovery successfully, your body has to be in a state, right? Yeah. The mind is housed in a body. So we have to take care of the body that is housing this mind to ensure that someone can be able to go about, right? Manage things like withdrawals and all that, so that now I can sit still. Now I have a clear head of mind. Then now we start processing the thoughts. Oh, okay. So what do I need? I need now to create a support system. How do I start making amends, building my relationship? Remember, over the course of my use, maybe I was deceitful, right? I caused harm, I hurt people, so I have to now make amends for some of that, right? So, but the priority in what areas will be started off with be dependent on how much, and also considering the goal of the person who's coming in for assistance. With that said, that those that you know are at the core have to be tackled so that you get at least some relief as you hope. Think about even as Joy was mentioning, like in the context of a rehab, right? When they come in there, they start with things that are primarily around you, right? Then when that's come, then later on, now we'll have, okay, now it's time to now bring family on board, right? Sometimes depending on the process of a rehabilitation center, I might require, maybe family comes in maybe after a month or so, for you to start to do some work within yourself, right? Take care of your body physically, having plenty of meals, doing some exercising, having an idea, okay, so now that's the sobriety, right? How does everyday activity feel like? How can I watch a movie? Because remember, sometimes patients will tell you, I've never watched a football game without maybe say a beer or a drink in front of me. So going back to that place, right? Trying to get fulfillment in everyday activity. Then now family starts coming in. Then now we even start preparing for other stressors outside. If you lack something that gives you a sense of productivity, relapse is very easy. What kind of activity do you need to engage in, right? If you find something that is financially rewarding, what can you do even as you hope to get back on track? So those are some of the things that we look at. Remember, during the course of addiction, a lot is lost, but most of the time we can be able now to get back on track, right? Make amends, but also some losses, of course, we just have to grieve them and then move forward, right? What else? What the next step of our life, growing around those things that we lost and the people that we had. So that's just a brief of how moving on or moving forward would look like in terms of recovery.
Wow, thank you so much for that. And Joy, coming back to you, is this part of the rehabilitation program, rebuilding life after an addiction?
Yes, it is part of the program. Like I had mentioned, we compartmentalize it into at least 3 months. So there is what is tackled in each and every month. And just like Brian is saying, we have also family involved sessions and also workplace involved sessions, because in each stage of the process or the program here, we need the involvement of either family or workplace, the people who are involved in bringing this client here. Reason being, they also need to understand what are we dealing with, and how can they also work on themselves so that it can be better support system for this person once he's outside there. So we can't be working on the client alone and leaving out the family, because addiction is also a family disease.
Wow, thank you so much for that. Allow me to, Stephen, are you back with us?
Yes, Pendo, I'm back.
Thank you for that. And as we're coming towards the end of the conversation, just what we're discussing now, the bit on rebuilding life after the course of addiction. What are some of the crucial steps in your experience that one should go through or would go through when it comes to rebuilding their life?
Okay. Yeah. So once I have been now true to myself, and I've acknowledged that I have a problem, I've realized that, you know what, I deserve better than what I'm living now. I can get better. I owe it not just to myself, but maybe even to my loved ones or even my community. Then you have a purpose. And with that purpose, I can then engage myself into a way forward, into a program. I will never underrate or downplay the importance of a professional, somebody who actually knows or can guide me through my individual journey to recovery or sobriety. And as we say, it's an everyday challenge. Let me call it that. I missed out on the relapse. You know, in Swahili they say kuteleza sio kuanguka. Get up, dust myself off, and continue to go forward. Question is, where is forward? What does forward look like? Where am I going? What do I want? And then how do I get there? Just repeating myself, also having the understanding that there will be rough patches, and you better best be prepared for when those rough patches come. So how are you going to do that? What is my support structure? What is my support system? Nimepangaje, what am I planning so that I don't end up in the pothole and act like I did know on this road there's massive potholes in Kilimani, for example. So really awareness and being prepared, and knowing that, as I said in Swahili, kuteleza sio kuanguka. In fact, what is going to happen is you will probably just come out of that ditch with a better understanding, or even with learned the hard knock lesson from experience. And I know, okay, if I go this way, then that is what is likely to happen because it happened the last time. And that's really what it is. It's one of those journeys where it's long, it's lifelong, and the road can get bumpy or muddy. Saa zingine ni mteremko, saa zingine ni mlima. And I think just being aware of that, because a lot of times we also are under the illusion or delusion that once I come out of retreat, Joy, then I'm fixed. I expect myself to be fixed, and everybody else expects me to be fixed because I was at Chiromo, I was at retreat, and so the result is 100% perfection, and there's nothing like that, unfortunately, or fortunately. Let me say fortunately, because it keeps me on my toes. It keeps me aware that, you know what, if you slack off, if you're not diligent, if you're not paying attention, if you're not keeping to routine, if you're not at your support group, if you're not taking care of yourself, then you are likely to go off the rails. And that could be a matter of life and death. Thank you.
Wow. Thank you so much for that, Stephen. And I like that you said that doesn't have to be an unfortunate occurrence. It could be fortunate in that it puts you in a point of being very aware and keen on your interactions and the impact of that to this journey that you're about to go through. So thank you so much for giving us your insights on this, and also to the rest of the panelists for great insights where alcohol abuse, addiction, and recovery is related. I want to take a moment to go to our Q&A section. We have a question that has just come in, and I'd like to direct this question to you, Maureen, hoping that you're here with us. And the question is coming from Naftal, who is asking, it has just disappeared on the screen, but allow me to retrieve it from this side. The question asks, could you talk about people pleasing, how it affects recovery and how to overcome it? Maureen, I'd like you to comment on this question. Could you talk about people pleasing, how it affects recovery and how to overcome it? Over to you, Maureen.
Hi, Pendo. So I hope you can hear me. I'd like to actually define what people pleasing is. And people pleasing is just the urge to, sorry about the background noise, but people pleasing is the urge to say yes when in real sense we mean no, or actually even hiding our own needs just to avoid any conflict with anyone, maybe friends, family, or even have that sense of rejection, or even seeking approval or validation. That's people pleasing. And when it comes to recovery, it can be a huge trigger or even make us step back in terms of that journey of recovery. And mostly these behaviors tend to come from childhood, any traumatic experience we've faced, and that's where this behavior develops. And how we can cope with people pleasing in recovery is actually, first of all, learning to say no kindly. We think telling someone no will be termed as rude, you're so mean, you're not considerate, but we can actually, in this journey of recovery, put ourselves first and learn to say no in a gentle way. Yeah, you could say things, I'll just pass on that group invite. Let's rain check for now. Or even something like, thank you for thinking of me, but I'll just pass as of now. And the thing about people pleasing is just practicing. It's hard the first time. Nothing is easy in this journey, but as